who are CEG. So this year we are actually celebrating our 25th anniversary, and we are made up of various different staff members. We have GPs that work for us, we have analysts, we have data scientists, we also have research side as well. And we cover the whole of NEL for the primary care areas. And we do a lot of various information for NEL. We provide dashboard, we provide searches, we do a lot of software tools, the APL tools, if you've seen those. And we also help commissioners and the public health sector too. Myself, as I said, I'm a facilitator, and we have support officers that are here to support you in anything that you need to do with any of the LISs, any QOF areas, anything like that. And like I said, we also publish research as well. Okay, so the agenda, what we're going to go through is why do you need to use templates and what's the importance of that? Also, which templates do you use? I'm also going to go through setting up the F12 key, so it has all of the templates that you need to use. And also, how do CEG Smart Templates work? We're then going to have some live demonstrations for you. We are going to go over the LTC and LIS template, the Women's Health Conditions template, and the Care Home template. Okay, so why do we need to use templates? Now, this is because we need to make sure that coding is standardized. So we have to make sure, because you have certain criteria that you need to hit for your LISs and for QOF and other domains, everyone codes the same, so it's standard and it's accurate. Then that way you know you're going to get paid for your QOF and your LISs if you're using templates. It also highlights that it will be using the correct SNOMED code. Because as you know, when you're in a consultation and you start typing in, say, smoking, for instance, you'll have lots of different codes come up. So by using a template, you know it's the correct SNOMED code. Plus, it also saves you time. So you don't have to sit and put in different codes. You just tick the box that's relevant for the information that you're inputting, and it saves you a little bit of time on that. Plus, it also ensures the importance of the data is captured, and also that it is captured within the patient records, because free texting is unsearchable. So you couldn't enter the information in the free text and then search for the information at a later date. Plus, obviously, it always gives you your income generator. So it is going to make sure, like I said, that you have completed the areas you are needed to get your income. And also data quality and reporting. We provide dashboards for you, so we know how you're doing in your certain areas. So if it's coded correctly, then it will highlight this information and be brought into the dashboard data. So you may see there are lots of different options when it comes to templates. So how do you know that you're using the right templates? And this is why later on I'm going to go through the F12 key, where it will have all of CEG templates and you'll know exactly which ones to use. When it comes to your QOF and your LISs, the correct template to use would be the LTC and LIS template. That covers a huge variety of different areas. It covers all of your long-term conditions, and within each page, it'll also have all of the LIS criterias within it as well. And we do know that selecting the template can be challenging for you. So which one is best? Again, it depends on your role. So predominantly clinicians, GPs will be using your LTC. Your nurses have a variety of different templates that they can use. That's including the LTC, the childhood immunisations, the adult immunisations, as well as pharmacists. Pharmacists can also use all of those templates as well. So we do know there are lots to choose from. And also when you're in EMIS, once you're in the consultation and you click the run template, you have the picker that will then pick any of the templates that you want. It's just bearing in mind, making sure you are using the most up-to-date one, because your template picker may have an old template in there. So always just make sure that you're refreshing your templates to make sure that you have the new ones. We at CEG, if we update any templates, it automatically gets sent down to you. So that's why you should always research for the template, just to make sure that you're using the latest version number.
Ross, did they call me?
So as I said, which is the best template to use? And this is the template, the
Let me
LTC
check
and Liz
my verdict
template.
check tomorrow.
Sorry,
Last
can you
year,
unmute your mic, please? We can hear someone.
Thank you. Thanks. So the LTC template, like I said, will cover all of your long-term conditions, plus there's additional pages on there, which when Ranjan goes through the live demonstration later, she will show you some pages, plus there's all the extra pages that are on there for you to go through. So how do smart templates work? So templates use visibility rules in the background. And what this will do is it will hide or display the sections that are irrelevant to the patient that's in front of you. So say, for instance, you have a patient that is on the diabetic register and on the CVD register. It's going to, on the LTC part, it will only show you those two sections. It will then also customize it. So within, if we're talking about diabetes, for instance, in the diabetes section, if you go on to the lab results page, it will also highlight the HbA1c fields for you, as well as still showing you, when it comes to lab results, all of the other sections as well. So this template is highly built on visibility rules in the background, and that's so that it's easier for you and you only need the relevant pages to you for that patient that is in front of you. So we just wanted to go through your Liz income. So you have potential earnings within all areas. So your current Liz's are your diabetes, your AF, your respiratory. You also have injectable therapies as well. So diabetes, there's two different areas. You have your 8 care processes, which is one payment, and then you have your free target treatments, which is another. So as you can see here, there's lots of different catchments. So it just depends where you get at the end of the year. Diabetes 8 care processes, the maximum you can reach is 78p per weighted patient. And then for each individual 3 target treatment, the maximum you can reach is 45.7p. So you can get that on your HbA1cs, your blood pressures, and then your statins. You do also have PCN targets on these two. So this is the only area out of the Liz's that you have PCN targets. So for the 8 care processes, you have a 60% target. And on the statins, it's 58 plus on those. And here's just to highlight the other areas. So you have your T today, which is the extended consultation for the type 2 diabetics, age 18 to 39. They must have the 30-minute appointment and all of the relevant information recorded for them. And again, you would use the LTC template, and this does have a visibility rule on it. So the T today section will only show up on this age group of 18 to 39. You've got your injectable therapies, again, which is to do with your type 2 diabetics, and that's for initiating insulin. That is worth £250 per patient, but you are also required to do follow-ups and HbA1c follow-ups. And your GLP initiation is worth £94, and you are required to do 2 follow-ups for those patients. You've got your AF, and that is split into 4 different sections. You have your AF case finding, and that is about you diagnosing the patient within practice, which requires you to have an irregular pulse recorded, 12 lead ECG done at the practice, and then a confirmation of an AF diagnosis, and that is £85 per patient. Moving on to your newly diagnosed, so this would be newly diagnosed from the 1st of April 25. The risk stratification area, there is 8 different areas that you are required to have. One is BP, BMI, CHA2DS2, orbit score, provisions of written information, alcohol and smoking. We provide you all the searches for these that will help you with the information. Also, if there is any of this missing, that will also show up on the search. And then of these same patients, you will be able to get some payment for initiation of anticoagulation. And then you would also do an anticoagulation follow-up after you've initiated the anticoagulation. So for a newly diagnosed AF patient, you can potentially get just over £99 if you complete all 3 sections on them. Then you have your respiratory. So you have case finding for both asthma and COPD, and that is for you to do the referral for them to have a pheno or for spirometry. So you can see your pheno tests are worth £23 per test, and the spirometry is worth 110. You're then required to do asthma reviews and COPD reviews, which is a review plus a action plan. So for the asthma, you would get £6 per patient, and this is because you get paid predominantly through QOF for doing different work. And it's the same with the COPD. You get a bigger payment through QOF, and then you'll get £10 per patient for doing these reviews and the personalised action plans on these patients. So that was just a quick capture just to show you what LISs you have currently and the payments and your potential earnings. So I'm going to pass over to Ranjan now, who's going to do a live demonstration for you on the templates and how to use them.
Okay, so I'm going to go through test patient. We don't have a live patient on our system. So this is an elderly test patient. And whilst you're in your consultation mode, when you go into your templates, you will have a picking list like Tracy explained earlier. When selecting a template, you'll notice this list. This list is like previously used templates, and these build up over time and can be out of date. So what we suggest is remove them on a regular basis. You can either remove them individually like this by right-clicking or remove all of them. Or use the F12 key that Tracy is going to demonstrate a little later on. So for today's session, I have sort of added these on just to save time. So I'm going to go through the LTC template. So in the LTC template, you've got this main page here. These are your little sections here, and we'll start with the main page. So where you see this in the blue section, these are your relevant QOF sections. So patients who have certain conditions, you will see just their conditions here. So this will at the start will tell you that this particular patient has got asthma, AF, CKDs, and so on. As we go down, you'll see consent section where obtaining consent can be completed, and then going down to examination section. So here, where you see the 2 asterisks on any of our templates, that tells you that it is the local incentive scheme and it's important section to complete. And when you see 1 asterisk, like I'm showing you here, that is for QOF. So for example, for the blood pressure reading, this patient was had a blood pressure in April 2024. And you can see the reading here. So you know now that the patient is overdue for blood pressure. So this is how you can sort of see when they had the certain checks, and if they've not had it done recently, you can then get everything done here. The second section is a QOF related section. Again, these are visibility rules, so you'll only see sections for this particular patient. Because this patient's got diabetes, we're seeing all this information, and it tells you what's required for QOF. These are the local incentive schemes. So the top section shows you the searches, what searches are available for you to have a look at to monitor your performance. So you'll see it says practice support searches, and then you go number 1 to number 5. So that's that section. Going down, for instance, for the AF, it tells you what you need to do. You need to have a orbit score within 3 months, Chadvat score within 3 months, blood pressure and BMI. Then you've got the smoking and alcohol. That's to be done within the year. And then you've got the POF AF section, and then you've got the respiratory, and it tells you exactly what you need to do for payment. You can see the action plan there, and then for COPD. And moving down to 8K processes as well. You've got the 8K processes and the treatment targets. The lab results section, any results are in the patient's record, you'll see them here and you'll see them, the dates there. If anyone's doing summarizing or need to enter the data, they can come here and enter the data. So this way you can see, if there are any blood tests or any user needs that need to be done as you go along. So this section now is an AF section. It's got the 2 asterisks here telling you that it's quite important that these sections are completed. You've got the Chadva score calculator here. And then you've got the relevant links as well here for your calculator, and you've got the BNF guidelines. So you'll see these links all over our templates to give you more information on the relevant sections. The top section here is the QOF section that's showing here. And then you've got, coming down, you've got the list section here with the 2 asterisks. Again, you need to do pulse, BMI, and all that. You can see again, this patient hasn't had anything done for quite some time, so that can be completed. And then you've got the risk stratification section here. We've got the explanation of what needs to be done. And then you've got the asterisks here that needs to be completed. And then you've got your medication section here and other additional blood tests that needs to be completed in this section. Moving on to asthma and COPD. You've got the asthma annual review, and then you've got the annual review due date. So make sure once the review is done, you complete the follow-up due date here. Then you've got the asthma examination. Then you've got these drop downs for the peak flow rate. And then you've got the spirometry section. So all these are giving you the different sections. And then you've got the asterisks again for reversibility here. Pheno section, and then you've got the information on inhaler technique. And then again, you've got the managed plan and COPD review sections down here. So I won't go through all of the template, but we are here to support you. So if after this session you have any questions, do let us know. Contact us via email. Just going to briefly go through the diabetes section. And you've got the top section of diabetes. That is for the T2Day program. So if you have patients 18 and 39, only those patients you'll see this section. And what you need to do is you need to do the extended consultation and 8K processes and tick this section to make sure that you don't miss out on the payments. And then you've got the other relevant sections for the diabetes, PHQ-9 and all the other sections here, preconception, examination, and so on. Then we've got the insulin initiation, GLP. And then you got, this patient has mental health, so you're seeing that patient. If you didn't, you wouldn't see this page. And then you've got the POF CKD section. So this patient has CKD, so you're seeing more information on that. Then here down below, we've got our standard information that are in most of our templates. So you'll have the reasonable adjustment, carers page. Adult immunized section is quite important. So have a look at this section, just in case if a patient hasn't had a flu jab and they need one, you can do opportunistically here. And then you've got the PHQ-9 GAT7. On our lifestyle intervention page, you see the smoking, alcohol, diet, and so on. And then you've got the exception reporting, the PCAs, we called exception reporting. So these are the sections for that. And then you've got dashboard links here if you want to look at any of our dashboards. So this is a demonstration on the LTC template. Okay, so we're going to move on to the women's condition template. Dr. Heen is going to go through this one.
Hello, everybody. My name's Maeve. I'm a GP. I work in Waltham Forest and I'm a clinical lead for CEG. So today I wanted to talk through the women's health condition templates. This is because these are templates which are particularly useful in clinical practice with patients, and they were developed with the women's health hubs, which we refer our patients to. So when you come into the templates, you will see the pages separated on the side. The first page you come into is the generic examination page. This is where you can note observations. It is also where we have added a chaperone drop-down box. So in later templates, if you do an intimate exam, you can document the chaperone using this template. The templates cover common conditions occurring in general practice. And then there are a few pages of other templates such as lifestyle interventions, ethnicity and wider determinants, which commonly are included in CEG templates. Moving on to the abnormal uterine bleeding template. All of the templates follow a specific order, starting with history taking, moving on to examination, investigations, and documenting management plan. So if we go back up to the start, the history taking in this template covers common symptoms that present in women presenting with abnormal uterine bleeding. So you can easily tick the symptoms on the left-hand side to ensure the correct codes, but there are also drop-down options and free text boxes. Moving down to the next section. There's the examination section for your abdominal and pelvic exam, and then the investigation section where there are suggested investigations. What's particularly useful in this template is that you can copy and paste the investigations if you think they are appropriate into the investigations required box. Moving down. There's the management section, which covers common advised management for this presentation. It also gives guidance about when to refer to gynecology or to social prescribing. So moving on to the chronic pelvic pain template. Once again, this starts with the history with common symptoms related to pelvic pain, but also aspects of patients' social history that may contribute to this presentation. What's particularly useful in this template is the red flag symptom section. So I find this useful as a clinician as prompts to ensure no red flags are missed, and it helps increase safety when managing this presentation. The examination section is useful here. Different signs which can be elicited in exam are separated into possible causes of the pain, such as musculoskeletal causes, endometriosis, or adenomyosis. The investigation section, once again, if you find that these suggestions are appropriate, it can be copy and pasted into the investigation tab. Going down to the management section. This covers suggested management plans for this presentation, depending on what you think the underlying cause is as well, such as gynecological causes, musculoskeletal causes. It also refers back to the red flag section. So if a red flag symptom was present, you can tick that you've referred urgently to gynecology. At the bottom of this template, there is also a resource link included where you can find further advice from the NICE guidance. Next to the polycystic ovary section. So once again, we start with history taking with common symptoms encountered in this condition. With tick boxes and free text if you desire. I'm going to go down. So the examination section, where you can record abdominal exam, pelvic exam, and BMI. The investigation part of this template, it includes the initial investigations which we are used to requesting when investigating possible polycystic ovary syndrome. However, it does include some further suggestions if the diagnosis isn't quite as simple to make or if other diagnoses need to be considered. In the diagnosis section, it includes diagnostic criteria for both adults and those under 18 to make your accurate diagnosis. And then the management plan. What's useful about the management plan in this template is that it gives advice in regards to menstrual management, but also in regards to the other symptoms that patients with polycystic ovaries experience, such as acne, hirsutism, and also guidance in those planning pregnancy. The next section then gives prompts in regards to when it would be appropriate to refer to gynecology, endocrinology, or fertility. There are also considerations to see if it would be appropriate to refer to social prescribing. The premenstrual disorders template is quite useful because the symptom section is separated into physical symptoms, psychological symptoms, and cognitive and behavioural symptoms. So you can see that the purple highlighted text helps you with prompts. So for instance, in this template, it's drawing your attention to whether the symptoms are occurring in a cyclical pattern, which aids in diagnosis. It also includes prompts for taking a menstrual history. In the diagnosis section, it gives you further a link to follow for patients if they needed to record a symptom diary. And then it gives you the criteria for making the diagnosis of PMD or variant PMD. The management section includes different recommended management, including use of hormonal contraceptives, but also SSRI and the various regimens that you can choose. And finally ends with other referrals that can be considered. Like I've said, there are sections on lifestyle intervention, ethnicity, or wider determinants, but I'm not going to focus on those in this presentation. Thank you very much.
Okay, are there any questions? I can move on to another template.
Frank, I just wanted to highlight a question that was put in the chat. Just going back to the LTC template, for this demonstration, we have taken off all of the visibility rules, and that is why you've seen all of those long-term conditions. So the patient that you have in front of you, you will only see what QOF register they are on. They will be the only LTC pages that will show up. Not all of them like we've shown you in this presentation.
Okay, I'm going to demonstrate the care home template. So for those of you who have CQC care homes and well, for this supplementary services list section, this is information regarding supplementary list. So this tells you about the geriatric assessment that needs to be 100%. And then it goes down to personalized care support plan, urgent care plan, and flu and pneumonia need to be 75%. So this just gives you brief highlight of what you need to achieve. Again, you've got the relevant QOF sections here. We've got quite a lot because with the test patients, we've taken the visibility rules out. And then here, this is the payment section. So this is what you get per bed here for nursing home and residential home. So for supplementary services, you need to, and for any other care homes, you need to complete this section to say on annual basis to say whether they're in a care home, nursing home, or residential home. And then if they've moved out of the care home, then tick this box and the date they moved out so they don't come into your targets. Those of you who are doing the supplementary services, as you can see in red, this must be completed at the same time as that section is completed. So for example, you've got a patient who's gone into the care home today, you tick that box and say whether nursing home or care home, and you tick this box as well to make sure that you receive payment. And for geriatric assessment, you've got this geriatric assessment, and then we've got assessment of needs, because this year the age range has changed. It's from 18 years and over. So for younger patients, you probably want to choose the assessment of needs. For a personalized care support plan, you've got the asterisks, and for urgent care plan and decline section. If a patient declines, please complete this section. And then we've got the examination page, like you've seen in the other template, with the blood pressure and all those areas. And then you've got A&E attendance. So any patients who've attended the A&E, it's important to complete this section. So visit to A&E and a follow-up within a week, if you can. And then you've got the drop down here again, when they were discharged, the date, and free text here. We've added in the Mental Capacity Act as well here, and deprivation of liberty. Going on to the assessment page, this is assessing all of the relevant sections. You've got the mobility, vision, hearing, functional, so on, speech, and that continues. Here we've got this section. It's got skin ulcer present. Only tick that if they have it. If they don't have it, that's fine. There's no need to tick this one. And then you've got the resources here. You've got NICE guidelines and the calculator here. And then you've got more information here. For falls page, again, complete as much as you can on the falls section. And then you've got the mental health here, dementia, and medication section. So this is quite important to complete. And then you've got the MDT section. So if they've attended the discussed in MDT, click here, add in free text to what was discussed at the MDT meeting, just briefly what was discussed. And also who else attended. If it's a GP, tick that box. So if there's other healthcare professionals, then tick that box and write down who attended as well. Then you got the palliative section. So you've got the anticipatory care and palliative section here. Care plan, again with one asterisk. And then you've got the discussion about the do not resuscitate here as well. And if they've been issued with the DS 1500, please complete this section too. And then you've got the place of care, place of death to record here. And if they need any bereavement support, complete here. Again, you'll have dates on the side if you've already completed. If you haven't, then you'll see no previous entry here. We've got the catheter section, and then you've got the immunization. So like we said, the flu vaccination, and pneumococcal, and all the other vaccinations can be completed in this section. And also you can look at the dates. If they've already had one, you'd see a date here. And then we're going on to the LTC QOF section. And you've got the asthma review because this patient is asthmatic. And then you've got the COPD because patient has got COPD. If they didn't have asthma or COPD, you probably wouldn't see all these sections here. And then you've got the exception reporting for QOF for all those sections that we looked at to complete as well. Patient's carers details, you've got carers section here, but we also have a carers separate template in more detail to complete if need be. So we've got this one, and we've got a NEL carers template. Lab results section, like I showed you in the LTC templates, similar. And then you've got the rest of our pages here, and then you've got the dashboard link for the care home here. So these are the three templates that we wanted to demonstrate.
Coding around the lives in a care home and enhanced service code. So you are required to re-enter this every year, but also to highlight that they should only be entered once within that year. So say, for instance, we've added these two codes on today, and then they was visited in the care home, and then lives in a care home was added again. That would counteract those two codes, and that would take them off of your list. So you must just remember, please only code it once within the year. If you do notice that your numbers have shifted a bit within your searches, please check this first, because this is normally the culprit as to why your patients would have gone missing off of that search. So just the two codes on one day within the year and no more entries after that. What this is you more than likely already use this, because this is how you'd normally set up your flu protocols, etc. So what we're advising is that you use this for all of the CEG templates. It is an individual user setup. So I do have instructions of how to do this here, but I'm also going to show you on a live demonstration what you need to do. It's very, very quick and simple, but it is an each individual setup. Not even a PC, individual PC, is an individual user setup. So please do make sure you go through and set this up, because it makes it so much easier, especially if you are unfamiliar with the templates that we provide for you. This will give you a whole list of everything that we provide for you. So here is the instructions. I will send them to you, but I'm just quickly going to show you exactly what you need to do, because it's very, very simple. So click on your F12 key, pick any letter that you have spare. And then you would go into the CEG, it will say BHR. Then you would go into BHR Resource Publisher and then Protocols. And you're looking for the template launcher, which is here. Double click on that. And then that is then in your F12 key. And then you just click on it. And what it will do is it gives you a list there of all of the templates that we supply for you. So just want to highlight, it is in alphabetical order, but unfortunately it does start again from the bottom with A's. So please do make sure that you scroll all the way down if you're looking for a certain template. So as you see, then it got down to the end and then it started another alphabet there for you. But we provide so many different templates and this will set it up there all in one place and you'll have access to all of them. Even when we update the templates, this F12 key automatically gets updated as well. So you can rest assured that the templates that you are using are the correct, most up-to-date templates. So please do have a go of setting that up so you know exactly what are the correct templates for you to use. That's your F12 key. So we've also supplied some useful links. If you haven't seen it, we have sent out the QOF Income Maximizer, which is an Excel spreadsheet. You do need your unique practice code sent to you. So please do contact your facilitator, myself or Billy, and we can give you your unique practice code. You go online and it will give you some parameters of for the different domains, how many more patients you need to do to potentially earn the maximum for that indicator. It's online based, like I said. If you need the code, please do let us know. We've also got the link to, we've got a new dashboard. We've combined all of the BHR Liz dashboards together, whereas previously they have been separate. So this is a new Power BI dashboard, which will show you everything you need to know all in one place. We have the same looking template, dashboard, which is the network DES contract as well. So this is a Power BI dashboard, and that covers all the sections that are relevant within that. And the same with the care homes. So all of these are online. This is linked. So when we send out this to you, you can click on these links and it will take you straight to the dashboards. Just to highlight, for dashboards, you no longer need a password because you have previously. So now you can click on the link and it's going to take you straight to the landing page. The landing page is where you will find NEL specific LISs. So you'll need to click on for your local incentive schemes, either your Barking and Dagenham, your Havering section or your Red Brick section. That's it. So thank you very much for attending. Like I said, if there's any more questions, please do let us know. If you think of anything after the webinar's finished, then please just pop us an email and we'll be happy to help you answer any questions that you may have.